Hi, everyone. I'm Dr. Michael Miyasaki, and we're really excited about today's program. Again, we have Garrett Caldwell, the CEO of Core Dental Laboratory, but the CEO also of the Pacific Aesthetic Continuum. And so both of those and myself, we really value education. And in saying that, today we have a guest, Dr. Galen Detrik of Thrive Dentist, who also practices in New Mexico and has an incredible story, one of those rags to riches story. But really quick before I let Dr. Detrik say anything, I just want to let everybody know that about a month ago during the holidays, I ordered a bunch of Dr. Dietrich's online education. It's really good stuff. It's everything from photography to doing direct composite, your class fours that where you really learn a lot, and then actually how to manage your practice and grow it. So it was really great material, and I just want to give that plug before I actually let Dr. Dietrich say anything. But Galen, welcome.
Mike, thank you so much. Garrett, you too. Thanks for the kind words, man, and thanks for joining a few of the courses. Like I said earlier, you should have just let me know what to give them to.
Yeah. Well, thank Do I get a credit card refund?
Yeah, you get that and a dinner, man, all the
Yeah.
things.
No, yeah. I
Thank,
will I will
sorry.
tell you, it's one of those things where like anything in life, if you get value out of it, you don't mind paying for it. So,
Yeah.
the value was there. I really enjoyed listening to everything. It took up my whole holiday because you have about 30 hours of content on there, even though it's in little 5-minute snippets. But
Yeah.
yeah, my family didn't seem to miss me during the holidays or at the table or anything like that. So we're good.
Galen, I
Well,
liked it, but I got stuck because I was on Landman. Sorry, brother.
give me both, man.
I
I know.
wasn't binging.
That's
So
so good.
the reason why, and this is kind of building upon that we have Dr. Dietrich on this is just that, I think everyone on this meeting right now, we really believe in the value of education. And I think I wanted, because he creates so much content in education and it's really quality education. I mean, the class four videos are just amazing to watch. And it's taken me from this level and I'm trying to climb up to your level now, which is great. And even the photography was all really good.
Thank you. Thank you very much.
But I just want to ask you, like, because you've been in this and you're in not only as a practicing clinician, as kind of a person developing content to help colleagues do better, what do you see as the importance of education in what we do, both professionally and personally?
It's a phenomenal question because I think we all have a hunger to not just learn, but to also teach. I actually think that every single one of us has that capacity. And when you get exposed to that, you really start to find how much you actually do know. And it's fun. It's fun to give that way. So a big part of teaching, to be honest with you, and creating our the Thrive Dentist and the CE ecosystem, as we call it, was really kind of selfish. I mean, I just enjoy teaching. I enjoy I enjoy that practicality of speaking with colleagues and learning from them just as much. So I think the backdrop is that education is something that we can all be really behind. The difference, though, is how you deliver it. And I think the delivery system is critical now more than ever before because the market's changed. It's changed for a variety of reasons, but I think probably one of the biggest is that people are overwhelmed. They're overwhelmed because of access. So at one point in time, you'd go to live courses, and it's really cool because it's very moderated and there's a lot of one-on-one touch, and that is really still the pinnacle of learning, I think. I don't think anyone can disagree with that. It's the best way to learn. It's just not the only way to learn. And so, we kind of pioneered with a few others this virtual space, and that was fantastic for a long period of time. But then what you started to find is that everyone started doing virtual. And so then any and everyone can access information. And it became an information overload. And now people buy courses and never go through them. And then they feel guilty that they didn't go through it. And so they won't go get something else, or they'll go guilt buy something else, right? And it unfortunately puts people in this really strange stasis of not really implementing things, but learning more. So it just kind
Mhm.
of flushes through. And it's not that different from social media, the way we consume information there. So I think the key is to be versatile in the way that you deliver content but also to give people rungs of a ladder and to slow them down, to help them. Like the best thing you can do as an educator, I think, is helping the person kind of find out like, where are you on this ladder? And let's just start there. Like, don't feel like you have to go here yet. Let's just start here. And some clinicians are ready to go to an in-person event and they have that skill set and they just need to be around other clinicians that are playing at a very high level. Others would need a webinar, you know, and just something to kind of get them going. So I think that's the most critical piece is just awareness and identifying where you are on that continuum of education.
No, I think you're absolutely right. And I think that's why the Pacific Aesthetic Continuum, we're so excited to be working with you in the Thrive tribe. I call it the tribe, just because you've got, the Pacific Aesthetic Continuum, we do lectures, but we also do more live patient education courses. So this weekend, we're doing a live patient education course with doctors bringing their patients in, and we work side by side, which is, I think, like you're mentioning. I mean, if that wasn't the best, I think we could get rid of all dental schools, right? And just tell people just stay at home, learn off the web.
Yeah.
But that's kind of the pinnacle of learning. But to get there, as you're saying, not everyone's ready to do that or can do that. And so I think the way that you take education and then format it into those bite-sized little chunks where you're eating and all of a sudden you've figured you've eaten the feast because the food's all gone, but you don't even feel like you're, stuffed because you've just been eating a little bit at a time. And I think that's great. So we eat the elephant one bite at a time instead of trying to figure out how to eat the whole elephant. And I think,
Yeah.
going back to education, one of the things that I think about is somebody once said, how do you have a miraculous life? You try to help other people have a miraculous life. And so, through education, we make their lives better. So I want to circle back around. When you look at your life and what education's done, imagine yourself, a new grad, you get out, you think you know it all because you spent $500,000 in 4 years in dental school.
Yeah.
And then you go out and practice. And then, like your journey is you learned a lot more to get to the level where you are. How did education change your life versus if you didn't seek that out and you were just kind of at the level at which you were when you graduated? How would that have made your life different today?
I mean, it's those it's the paradox of choice, you know. You go back in time and you think like where else on this like parallels of life journeys would I be? And probably astronomically different, quite honestly. Um, I was very blessed to have a phenomenal mentor who was a fellow in the AACD. He's actually just now looking to retire. He's 80 something now, and he's a phenomenal clinician. He's just now getting out of the ring, retiring the gloves. And he was instrumental in pushing me. And the reason I think that was so powerful is that it kind of, if I could wave a wand, I would have every dentist coming out of dental school be in some form of a mentorship or associateship type of practice so that they're apprenticing and then have that dentist, he or she, really helping them take that next step clinically. And that way, there's a pulse on that person the entire time. Here's how I get you to where you need to be. That's what I had. And so it was an incredible blessing. I got shipped out to Chicago and I went to a Jason Smithson course right away. And, it lit me up. It got me super excited. And then from there, it was just really like I went to the pack a year later, and that completely opened up my eyes to comprehensive dentistry. You hear about it in dental school, you don't know how to do it. I mean, you get out of dental school doing one root canal probably, and it's a couple of crowns and some extractions nowadays, if even that. And so you don't, it's like a myth, kind of. And then I think you get into practice and you're completely overwhelmed in an exam and hygiene because you realize like there's 28 of these things and there's problems on seven of them. And I don't know how or why it's happening and how to put all those pieces together. I got slowed down to speed up by my mentor. So I think if I didn't have that, I think my educational journey, of course, would have been different, but the way I practice would be entirely different. I wouldn't have an education. Uh, I probably wouldn't have a business, honestly. I
Yeah.
think it'd be really different, Mike. Very different.
So I guess, we're talking about how you make education so uh, available and usable, and yet there's doctors that don't take your course, or it's not because they don't hear about it, because I know that's marketing, that's always something, but somebody who learns about what it is that you have to offer, and yet they don't sign up. What do you
Yeah.
think is the biggest obstacle? What keeps doctors from actually taking the education that would change their personal and professional lives?
I think it's easy to be in a position where you can blame the dentist, you know? You're like, why don't you get it? Why don't you understand it? This is so great. Or this is, this could change your life. And maybe there's some truth to that, but I always like to take personal responsibility and ask myself, how could I have messaged this better? How could I have packaged it differently? How could I have come to that person? And I think it's actually the easiest way to explain it is probably by looking at an example that's near and dear to all of us. If you're a practitioner, which we all are, you have new patients coming in. And the goal, of course, is to bring in more of those and to convert people who are already in your practice to doing the dentistry that they require, that they need. There's a certain degree of compassion and iteration that you have to have that makes you that much better. And it's actually the difference between a practice that's really successful and thriving and a practice that's maybe not doing that great. They're kind of plateaued. It's the practitioners that are willing to push themselves, take that responsibility, say, how could I do this a little bit better? And so I actually think that's my kids, we love watching Beast games right now, Mr. Beast and all of his, and it's a ton of fun to watch. But one of the things
Mhm.
that I watch as I'm seeing this, I'm seeing the psychology and behavior of human beings. And one of the things that Mr. Beast will do is, right, everyone's trying to vie for $5 million. But he'll have people opt out for 1,000 because it's cash right now. And then the person says, nah, 1,000's not enough, but 10,000 I do it for, and then they opt out. So it dwindles, right? And you have those few people that are like, no, I'm in it for five. And I think it's very similar in terms of the way patients go through. Not everyone's going to do comprehensive dentistry. Most are going to do one at a time. That's the way they're trained. You have to have patience for that. Same thing with dentists. Most dentists are not going to want to take every single course that we have or sign up for the pack. They're not going to do the life transforming $5 million treatment, right? But what they will do is they'll say yes to that $1,000. They'll say yes to the next. And our job is to help curate that experience and to have a lot of patience and a lot of compassion for that space. I think that's the name of the game.
Hmm. That that's a good way to answer that because you're absolutely right. I hope people that are watching or listening to this will get motivated because I think one of the things too is cost, like you were mentioning. If you take a course, like I know implant courses are some of the most costly courses sometimes to take,
Yeah.
live patient treatment courses and stuff like that. And what I've noticed over all these years is if I spend $5,000 or $10,000 or $20,000 to take a course, I get so focused on that, I do a lot more of that, and so all of a sudden you may not be doing any implants. You take a course, you go back and you do 10 implants, in the first week or first month or whatever. And I've learned that my mind, whatever it's focused on, will see more opportunities to do that service, and that ultimately ends up paying for that course. So. Yeah, I hope everybody gets on to yours because they're very affordable, and I think it will. When you're talking about how to talk to your patients about treatment or how to do comprehensive dentistry, yeah, I think your ideas are great. So that sounds good.
Mike, on that point, I think this is something that, yeah, Garrett and I talked about this actually when you guys were out and we had dinner. And it's an interesting concept. We always think about the things that are the biggest obstacles, and it's easy to say it's time or money or, something else in life. I always call it the big three: time, money, and relationships. You feel like if you're going to be doing this, it's going to take you away from your family. Therefore, a relationship's kind of stopping you. That's the obstacle. And those are easy to point to and say that's the problem. But I actually think that the issue for most of us, maybe all of us actually, at some varying level, is what I call value calibration. And so the best way to think about this is if I tell a person, hey, you can get a regular cleaning, or sorry, a deep cleaning for, let's say $400, $500 a quadrant, or I can do a full mouth of Lanap and you'll get this outcome. And that's $10,000. Or you can go to a perio surgeon, you can get this and it's going to cost 13,000, whatever it is. A person has a certain idea in their mind based upon their environment, their circumstances, the way they grew up, what they've heard, that has calibrated them to what that thing should cost. And our job, one of the greatest skill sets you could ever possess, is the ability to recalibrate a person's value.
Mhm.
And so I can easily tell a person, hey, this webinar that we're going to teach you how to do class 4, and it's $100. And some people are going to be like, that's a steal. And others are going to say, that's too cheap. It must not be that good. And others are going to say, I can't afford that.
Mhm.
And that's the interesting thing, is that it's actually a very irrelevant number. It's where that person's at. So that's our messaging. That's the time that it takes with a patient chairside to help them recalibrate and see, why did you position at that point and what do I get from this? That's
Mhm.
communication. That's what it all comes
Mhm.
down to.
Yeah, you're right. And talking about this, so one of the questions I had is, how do you view the difference between not necessarily your well, maybe your web-based courses, because we all do the same thing. Every day we pick up our phone and there's some social media thing or Instagram thing, doing a composite or doing a veneer or crown. So we're inundated by that all the time. And I know sometimes I'll watch that and I'll go, wow, now I've taken some CE today. And then
Mm.
when a course comes by, like the pack with the live patient course, I go, no, I don't need to take that because I do so much other CE. Do you see a difference on, when people are seeing the shorts on Instagram versus when they take a course that's more of a live course? It could be a live lecture or a live patient course.
Yeah, big time. I mean, YouTube University exists for a reason. It's really easy, right? It's very easy. It's a short amount of time typically that is your investment. It's free essentially, and so there's very little output that is required of a person for what is a perceived pretty amazing outcome. But to your point, you said this a number of times, I think the difficulty is implementation. You can go learn 5, 6, 7 different skill sets in the next 3 hours on YouTube, and you're probably not going to implement a single one of them. That's just the reality. That's what all the statistics would tell you. You're not
Mm-hmm.
going to do that. Why? Because no one's holding your hand, number one, which is why in person is so helpful. You're forced, you're forced to get an outcome. And that's why it's so powerful is to go in person. When you look at the virtual side of things, I think that is more you get people who take really big strides with virtual. I'm one of those people. I am, this was a weird thing to come to an understanding around because it sounds almost arrogant at first until you really think about it. But I don't require a lot of motivation to do things. I just don't need that. If I want something, I just go get it. And so if I learned a skill set by watching YouTube, or I go and I spend time with you, Mike, and I see the way you do things, I'm going to be doing that same thing on Monday because I've trained myself to go get it. And one of the things I'll say when I lecture, and even when I do webinars, I'll say, just because I can do it doesn't mean you can. And just because I couldn't do it doesn't mean you couldn't. Meaning everyone's different. And you have to understand yourself and your motivations and where you really are at. I think that's the most critical piece. So there's a place for both small, bite-sized virtual education, whether it's free or paid, and the in-person. But I think a person's really got to know who they are and where they're
Mm-hmm.
beginning.
I think you said right. I think accountability, because when you're with a group and you're seeing each other live over and over, it creates some kind of accountability. Like in our course, if you're going to do a veneer case, let's say during the course, we're going to work with you to figure out, okay, is that the best case to bring into the course? Okay, here's the lab communication. Let's get it set up with the lab. So, there's accountability. So it's not just watching a video and saying, okay, someday I'll do this, but it's going through the education where we're holding your hand as you go through and actually do it. So we have that accountability. And I think the other key part is, like they say, you become the like those that are the closest to you, right? The five closest friends. And so one of the reasons why I liked watching your videos at the end of the year is just mentally I was gearing my mind up for our practice growth this year. And
Yeah.
we don't know what the economy is going to be like or what the politics or whatever because everything's kind of up in the air right now. But I just kept listening to you saying, okay, in your practice, you were doing 6 million a year, 6 million a year, and so it made me think, okay, what I'm going to do is I don't even have to do that much work, but that's a target. If
Yeah.
Galen can do it, then maybe I can get close to that, or I can grow my practice. So it's inspirational when you're with doctors. Like this weekend, we're doing a live patient course, and we had Dr. Jack Griffin coming in, and he's going to be helping us teach this course. Well, Dr. Griffin's been voted one of the best, dentists in the United States and the country, very active in aesthetics, AACD, and everybody, right?
Yeah.
So for me to spend 2 days with Jack teaching this course, again, will raise the level of my expectations for myself. I'll learn new skills to help me get there. And I just think it really becomes this kind of like that stone rolling down the hill where you just pick up a little bit, a little bit, a little bit, a little bit. And by the time you get down there, after taking this ride, you're a different rock than when you started, right? You have so many different skills, so much value to offer your patients. And it really becomes fun and like we were talking about, almost effortless because it's fun, enjoyable, and just the way you go through the process.
A lot of clinicians are going to probably resonate with this idea. And it's a relatively new concept. It's the way we're positioning our content now. Again, we're always trying to iterate, find out what do dentists really need. So we're talking to them all the time. What worked for you? What did you learn from this content? What did you learn from this course? And then where are you getting stuck? And you just said, a person is very much the average almost of the five people that are closest to them. Well, your team is definitely some of those people that are closest to you.
Hmm.
It's interesting that I think a lot of practitioners can get excited going to a course and then they come back and the staff's like, he or she's excited again, just give it a week.
Yep.
And the weekend high goes and then you're right back to it. And that's because your environment does pull you back down, not because they're bad. It's that your team doesn't really get much out of it. They're not seeing that ROI necessarily. And they also feel like, I got to do more now for you. And we're
Mhm.
not going to have that same consistency. So, what we've started to do with our content is actually aim it at team members. So, for example, take photography. Photography is somewhat difficult for a dentist to take on because they think to themselves, on top of everything that I already do, and now I have to go stop what I'm doing, take photos, edit these, figure it all out, get onto social media. By the time they've gone through those iterations in their mind, they're like, I'm not going to do that. It's fine. Whatever we're doing right now is working. What we're doing is we're saying, let's change your environment versus trying to change you. So you buy a course as a dentist, and what we do is we train your team. So they're going to create the studio for you. They're going to learn how to take these photos so that it actually doesn't require much of an output from you other than swipe a credit card. And then your team brings you this brand new approach to the way you do dentistry. That way, we're kind of elevating with those people around you in an interesting way that I don't think dentistry's really done before. And I think there's something there. There's some grit to that. And I also think it inspires a dentist because they didn't have to do much and now their practice is better for it. Teams empowered, teams excited, they feel like they're a part of something bigger. I think that's a part of the way that we can change dentists and get them more excited to then take those next levels courses like the pack and really get invested because that's fun. That's when
Yeah.
dentistry really becomes real.
Yeah. No, I think that I know you just use photography as an example, but one of the things I think in practices today, photography is a way you really build your practice because social media out there, the marketing, we have patients call all the time at our front desk like, oh, the patients want to see befores and afters, so now we have to post more befores and afters, and that's just the way the world is.
Yeah.
Because as all of us, if you could be looking at a refrigerator on Amazon and you want to see what it looks like and how it fits, and you can see what it look like in your space and everything now, just on your Amazon app. So it's just the way the world's going. So if you're, this is just an example that Dr. Detrik pulled out as an example, but I would just tell you that I think in order to grow your practices in the years moving forward, at least right now, you really have to have your photographic skills down. And it's even better if your team does it for you and you don't have to do all the thinking.
Right? Yeah.
Now, I did when I was watching those videos, I ordered my soft boxes. I got everything all set back up.
Yep.
So yeah,
Well, and
You-
then that's an ode to you a little because I mean, Mike, you're very you're extremely accomplished. I mean, top 0.001% of dentists in the US. You are in terms of your skill as well as your notoriety. Also your humility. Garrett and I are always talking
yeah,
about that. It's true. But you're very motivated to go make those changes. And I don't think it's a bad thing that a lot of dentists are not, because I have compassion for that. I have friends that are my age and they're bringing on associates that are a couple years out of school and they're 600,000 plus in debt. I mean, you'll be servicing that debt for the next 25 years of your life, and it'll still be probably around 300, 400,000 when you're
Yeah.
done. You know, it's just, I mean, it's an impossible task in some ways. And so I get why they feel overwhelmed and a little disheartened. But that's where we get to come in. I think Thrive exists more as this bridge to say, how do we get people to start getting excited about these in-person courses without feeling like, oh my gosh, am I going to ever be able to do comprehensive dentistry when I barely know how to do a crown prep in 2 hours?
Yeah.
We're there to bridge that gap.
The way I look at it is a couple things. Is when I go to a course, when I watch your videos, I'm one of those, sometimes you go to a course and they could be selling lasers or something like that. And, the doctors sit there and they go, well, I really liked what I heard. I got to think about that, right? And
Mm.
I'm one of those doctors that, well, I like what I heard. Okay, I'm going to commit. I'm going to invest in that laser. So before I leave, the sales reps always like me because I'm the guy who signs the paper, right?
Yeah.
And so it's just like the same thing, watching your videos motivated me to say, okay, I do need to invest more in my photography. What equipment do I need? Okay, let me go ahead and order this, and this. Because I think I see a lot of doctors that come to the lectures that we do and they go, no, I really like what you're talking about. And I go, okay, are you going to, buy the equipment or all the pieces it takes to do that protocol? And they're like, I need to think about it. And I go, but if you think about it, you're never going to do it. And I think those are the doctors that
Yeah.
so the second part of this is you made a good point. I've got lots of debt. I can't spend more money because I need to service that debt. Well, if you look at that as spending, that's a loss. But if you look at that as I need to invest more money so I can make more money to pay off that debt, then it takes on it's a whole different perspective. And that's why I look at it. I look at it like, okay, I've got my debts, but I've got to invest either to do more marketing or I've got to invest in my education because that's going to allow me to make more revenue, and that revenue is going to help me pay things off. And I think the difference is we're teaching comprehensive dentistry restored with aesthetic restorations. Why aesthetic restorations? Because a lot of times they're more conservative than traditional dentistry. Where traditional dentistry, where maybe we prep for a PFM crown, well, we can do a all ceramic veneer and save more tooth, but give the patient that smile that they're looking for, that sort of thing. So I think it really comes down to the perspective that people are looking. And I don't know. I think, my words of advice would be don't look at it as a spend, look at it as an investment, and then commit and get off the sidelines because I don't know, if you never do it, then you'll never reap the rewards, and you'll spend your entire life thinking, I can't spend to buy this or that, or you'll feel guilty about what you spend because you still owe on the student debt. So, try to do everything you can to get rid of that as soon as you can.
Yeah, it's a mentality that when you are shackled by debt to some degree, there's always that feeling. People usually kind of go through one too, you know. They either feel like it's insurmountable. What's a few extra $1,000 to it? And
Hmm.
those people just go ahead and spend it and buy it and let's keep going. And then there's others who really are like, I have to stop the bleeding like as soon as possible. And I think both have problems. What you want to do is, I think too many of us are collectors, and we need to be more in the mindset of current. So
Hmm.
we call money currency for a reason. It does not stay in one place.
Hmm.
The money that's in your bank account has already been lent, five, six, seven,
Hmm.
eight times because it's constantly in motion, whether that's good or bad. That's how
Yeah.
people make money off of you. And so I think we have to have that same mentality of that money is just flowing through us. If you want a patient to spend money with you, you're asking them to take a leap of faith and trust you to get
Hmm.
an outcome that they don't have yet, and they're going to spend first.
Hmm.
I think we have to get a mentality that dental school was the great investment and the last one that we'll do. It was the entry fee. From
Yeah.
there on, everything is what are you willing to embody that you're asking of your patients? And that's what I always think. I mean, I have a $20,000 sleeve on my arm, right? And I know what it's like to sit in a chair for 8 hours and to spend that kind of money on art because I love that.
Yeah.
I can talk to a person who did a full mouth rehab with me and say, I've spent that and I've sat there in that chair and I know what it's like to feel pain and I know what it's like to really enjoy what I'm
Hmm.
getting from that.
Hmm.
That's the
Yeah, you're
important
right.
thing.
Yeah. I saw a thought that I was going on is we're doing comprehensive dentistry. I just want people to understand because I think some people think that if you're generating a lot of revenue in dentistry, that maybe you're doing too over treating, patients. And we're not trying to do that. I think One of the things is the more you learn, the more you see, right? So a patient comes in and they've got that worn dentition, and the majority of dentists would say, "Oh, you've got a lot of worn teeth. I need to do a crown here because that tooth is so worn before it breaks." Whereas if somebody who has the skills and the ability might look at the patient and say, do you suffer from headaches and jaw joint problems? The patient says yes. They might say, do you have sleep apnea? The patient says yes. And then you look at that and you explain to the patient, look at all the wear and tear that you've got going on in your teeth. What's happening is you're wearing your teeth down and your jaw's repositioning, causing the headaches that debilitate you during the day, and then causing the sleep apnea that causes you to choke all night. What I can do is we can go ahead and we can do phase one therapy, that be an orthotic to let your jaw go back to a better position, open up your airway, see how you do. And then from there, if you decide you'd like to do it, then we can use aesthetic restorations to help maintain
Mhm.
that occlusion or bite so you don't have to wear an orthotic the rest of your life.
Right.
And that's the type of dentistry that we're talking about. So, if a patient comes in and they've got pristine teeth, you know what? We're going to do the ethical thing and tell the patient, you've got really good teeth. We're going to help you maintain that. And then the patients that come in with different wants, it could just be a nicer smile or it could be a functional issue. Because you've had the training, you can address all of that in a very ethical way, and it has nothing to do with trying to overtreat your patients to generate a revenue goal. And I think people need to understand that, because those of us that have been doing comprehensive dentistry for a long time, I know a couple decades ago that's what was going around. Oh, you guys are over treating. No, it's those that think we're over treating. You think that because you don't see what it is that needs to be treated, right? So, it's kind of an eye-opening experience. And I think in today's environment, I think being able to do ethical dentistry by providing comprehensive dentistry that is actually needed is actually a skill that I hope all of my colleagues learn and are able to practice.
I hope so too. I mean, I think it's a great point to have brought up, Mike, because it is a big thing that we'll get. People think it's almost like a money grab, or that you are taking an unethical approach to a patient's. And I mean, the reality is there's a lot of other dentistry that you and I do. I can do 30, 40 arches in a year using core, phenomenal lab, and they make my life easy. And there's still a lot of other time in the clinic that I'm doing single crowns, or I'm
Mhm.
doing fillings, or I'm doing MFDs, I'm doing bite adjustments, orthotics, whatever it is. And it's always about the MVP, the minimum viable procedure. What is that
Mhm.
patient? What is that basic need for that patient?
Mhm.
And it doesn't need to be any more than that. It shouldn't be any more than that. But some people are going to come to you needing full arch dentistry. And if you don't know how to do that, then I don't think there's any other way of saying it nicely. You're not able to treat that person the way that they need. In
Mhm.
which case, that's actually the unethical piece. If you
Mhm.
don't know how to do it, you should be referring them to someone who does. But if you just let that person go because you're afraid to have that conversation about finances, that's actually unethical.
It's just interesting to sit here and listen. Galen being newer in education, um, and Galen, there's benefits to that. You still have all your hair and your skin's nice and tight. You're still smiling with a big, big smile.
Maybe not
After
back here.
30 years, we're going to revisit this, and you're going to see why Mike and I are all worn down here. Uh, but
You guys are
it's the
vibing, man.
same. Yeah, it's the same challenges, Galen, that you're recognizing now,
Yeah.
that you're approaching differently than, but the same challenges that we face, that we identified. We want everybody to come in at a high level. And I think one of the most important things that I heard you hit on today is we're not all the same, and our capacity for entry is not all the same.
Yeah.
And it's okay to be different. Somebody wants to come in and sign up for John Coyce and for Pacific Aesthetic Continuum and for Mike's implant courses and all of the above, and they will, and they'll invest hundreds of thousands of dollars and they'll go for it. And we've experienced those doctors within just a few years. They
Mhm.
have multi-million-dollar practices, but it's where they wanted to go.
Yeah.
Everyone wants to go there or be there, but not everybody has a taste or flavor for getting in at that same level. And we can't push that. We can't push that on folks. And so I think having Thrive in the process of combining these two programs where somebody can come in and put a toe in the water and get really great knowledge, but maybe 5 to 7 minutes at a time
Yeah.
until and not be so invested, but allow them to take that journey on their own, but make available the deeper journey and the mentorship that goes with it. Internet changes, online shopping, it's really affected brick and mortar. There's been a lot of changes, and that's what's happening in dentistry
Yeah.
with DSOs, with fees, with insurance companies. So, how do you address that? Unless you have mentorship and unless you have a way to come in at a way you're comfortable. So, we can call Galen or Mike, and they can tell you exactly how to buy the $10 million building. And they'll even say you should take all the money you have and invest it there. And they would probably be right, but not everybody has that comfort level. So I really like about what I'm hearing today is that you've really identified that people are different. We all want to be successful, but we all are a little bit afraid to get in at the top level, maybe. So offer different levels. And I hope that's what the listeners today really get out of this is that, get busy getting busy,
Yep.
and that's the most important thing. Fear makes cowards of us all, and it's something you can accomplish. And again, I look at the pack, I look at Dr. Griffin, I look at Dr. Miyazaki, I look at Dr. Galen Detrik, I look at Dr. Tom Dudney, I look at Dr. Franklin, I look at the doctors that are associated with the pack that are our partners, and all of them are available to mentor.
Hmm.
So I hope that folks that are listening really get it, that you don't have to come out and just go and buy the Ferrari. You can come out and start on a bicycle if that's what makes you comfortable. But
Right.
get moving down the road. That's the key message, I think.
It's such a good point, Garrett. We have a lot, at this stage in life, I'll put it my age group, right? Kind of your 30s to mid 40s. You're having kids. And one of the key things I consistently see is that, you're exposed to social media and see these elaborate, amazing places to go travel to. And maybe you're talking to a dentist who's, in their 50s or 60s, and they've done these things. And now they are able to travel and their kids are out of the house. And if you don't compare yourself to the right person, you can get stuck, but you also always want to have a vision. So I look at someone like Mike and I'm like, I see vision there. And there's things that I want to pattern. And I can do that now where I'm at. But if you're younger, you don't want to judge yourself that way. You might just say, instead of a 3-month vacation to Italy, maybe I just take my wife out and we do a little date night,
That's
and just
right.
get those a
Yeah.
week. And it's like, you got to take a break from the kids. You got to be able to pour back into the person that you love the most. And that's one of the things that you see go, right? With the stress of money and the stress of holding a practice or associating, is that your relationships start to kind of wither a little bit and you get stressed and your health goes. It's like you just need the micro tweaks. Like you said, get busy getting busy. What's that first little thing? Calendar it. And now move on to the next thing. But there has to be a plan. So it's both. Get started, but have a vision, have a plan.
Hmm.
I know that Davina, your partner and your wife, does some coaching,
Yep.
and I know that she doesn't set minimums on coaching, from what I understand. And I know that one of her main focuses is let's pick, let's look at everything you're trying to do, and let's see what you're not doing well, what you are doing well. Let's just do one thing and change one thing. And I know she was telling me she has challenges because the doctors want to fix everything. And her focus is let's fix one thing. Let's fix this one thing. And then when we get that done, we'll go to the next ladder. And
Yeah.
we do the same thing in business. It's like we create a blueprint, and the blueprint is from the foundation all the way to the finish of the house.
Yeah.
But we might go through 4 steps and get to the plumbing. We have a plumbing problem. We don't keep building the house until we finish fixing the plumbing problem. And I think it's the same thing in your dental business, is that there's a lot of things going well, a lot of things not going well. Just start building step by step, and maybe ask for some coaching that you don't have to necessarily commit 60, $70,000 to. How can you get some mentorship to identify what the most important thing is that you're stuck on in your practice, and then what you need to do to accent that with
Yeah.
education? And I think that's important. Sometimes you need, I think not sometimes, all the time you need a mentor. And I think that's another challenging thing is mentorship is expensive and another thing to pay for. So hopefully with Thrive, introducing Thrive with our group in the future here, we can introduce Davina a little more and what she offers so that doctors can access that professional opinion and that help.
Just so people know that there is a possibility of having something that doesn't cost you an arm and a leg. We have created a program and it's called Agency, but it's basically uh, the tagline for it is no grind, just quiet growth. It's for the people that just, you know what, hey, I'm going to show up and I want to start to make some strides in the right direction, but I'm not ready to commit 70 grand. I'm not trying to get crazy. I just want to I want some insight from a person who really knows what's going on, who's built a multi-million dollar business. What's that little touch you can give me and just keep me on the rails, right? Can you be the bumpers for me so that I'm not focused on the wrong things and building in a circle? Let's just keep you going the right direction. And that is available. That's not just us. There's plenty of people that have that ability to just pour into you and to mentor you. You got to ask. You got, just get out there and go ask for it.
I think in the old days, and I'm talking 30 years ago, it's back in the early mid 90s, you bought in for Mike when we were teaching at, LVI and Aesthetic Advantage and Pack Live, you came all in. It was all or nothing. We had a big group of doctors that wanted to come in, and you pretty much had to sign up for 18 months of coaching at 50 grand, and you had to sign up for 4 programs at 10 grand a pop. And that worked then, but things have changed.
Yeah.
And I think it's exciting to offer our colleagues the opportunity to take small bites and go as quickly or as slowly as they want to, but to get on the bus.
Yeah.
Important.
Yeah. 100%.
Yeah, that's it. That's all I have. I think what you guys brought today was just phenomenal, both of you. Yeah,
Thanks, Garrett. And Mike, great
yeah,
job. Just good
Yeah,
phenomenal.
questions.
yeah, really nice to talk to Dr. Detrik again and look forward to the next time. So, yeah, real quick, I hope you can take some tips away from this. We're looking forward to seeing you during some of our educational events and activities that both the Pacific Aesthetic Continuum and Thrive, or the combination of the two, will be putting on in the upcoming months, and we're really excited about that. So, yeah, Galen, Garrett, thank you very much for your time, and I look forward to our next get together. Thank you.
Mike, great job. Thank you. Thank you, Dr. Dietrich. Appreciate it.
No, you guys you're most welcome. And I'll say one thing very quickly. I just think that any dentist listen to this, you got to know that Mike, Garrett, the team at PAC, and the lab core, they're dentist centric. And I think that that is lost in a lot of education nowadays. There's people just looking to kind of create a business to sell it, DSO mentality. That's not what you get with you guys. And I've always appreciated that from the lab all the way up. You guys are very focused on just truly pouring into dentists, making them better clinicians and more present at home and a little more financially stable and thriving. So cheers to you guys. You guys do an amazing job.
Mhm. Great. Oh, thank you very much.
Yeah.
Thank you, guys. Great job.
Yeah.
Thank you.
Take care.
Ciao, guys.
All right. No, that was good. Great job.